Welcome back to the Intersection Podcast. This is a project of the Robert Wood Johnson Foundation, and this is a space for advocacy and healthcare leaders to talk to each other and share how they're trying to build anti-racist healthcare systems. You can find us online at meetattheintersection.org. I'm your host, Anton Gunn, and I'm happy to be joined today by three amazing guests. Dr. Giridhar Mallya, Senior Policy Officer at the Robert Wood Johnson Foundation, Dr. Loren Robinson, Chief Medical Officer and VP of Medical Affairs at CHRISTUS Health, and Kathryn Haines, Health Equity Manager at the Virginia Interfaith Center for Public Policy. I appreciate y'all joining me today to explore the rapidly evolving DEI landscape. When you say DEI, some folks respond with, what is that and what do you mean by DEI? How do you help educate people what DEI is? How do we respond to that when people think it's about quotas and just hiring people who look differently without any context of how it's focused on improvement? And Dr. Mallya, I'll start with you on that.
One thing that we're actually seeing, both just from conversations with people and polling, is that when you say diversity, equity, and inclusion, that actually gets another 10% of people to say, oh, I think that's a good thing. So even moving from the acronym to saying the words, because the values are fairly well shared. So that's the first thing. The second thing is to give some specific examples. We have this piece coming out very soon that's entitled Health Equity Work Leads to Better Care for Everybody. One of my favorite examples is with lung transplantation. So waiting lists for lung transplants are notoriously long, and people of color tend to wait much longer to get transplants than white folks. In 2005, the entity that manages the allocation of lung transplants said, we need a better system because it's particularly not working for people of color, but it's also not working for everybody else. So they made some race-conscious changes. So they took into account that certain racial groups were being disadvantaged, while also paying attention to the fact that the system doesn't work for anyone very well. The new system they put in place led to reductions in mortality, so people dying while they're on the waiting list, and more transplants for everybody. But then it also closed those gaps by race. So to me, that's a great example of diversity, equity, and inclusion at work. It addressed this immoral racial disparity that we saw in lung transplantation, and it created a better system for everybody.
Wow, that's phenomenal to hear. Kathryn, how do you educate people on what DEI is versus what it's not?
I definitely don't say DEI anymore, but I do talk a lot about equity and give examples of what that means. One of the bills that passed this General Assembly was to require bias reduction training in the form of unconscious bias and cultural competency with healthcare providers. And so if I met some resistance, I might share so many different examples, but one might be the VBAC calculator. Even though it was debunked as wrong, it is still in use, right? So the VBAC calculator assesses your success of having a vaginal birth after a cesarean section. And they used to put Black as a stand-in to mean that you had a lower chance of having a vaginal birth, right? But it wasn't the fact that you were Black. It was the fact that you had higher blood pressure. So you should put higher blood pressure is a risk, not your race, right? When we're using race instead of blood pressure or some other factor, I think everybody understands why it's important to remove things like that. And there's so many different examples that I have. If I'm talking about how it benefits everybody, I might talk about the history of midwives. I think a lot of people are familiar with the fact that the Flexner report, that it shut down Black medical universities, but lesser known is that its stated goal was to end midwifery and end home birth. And Virginia, we have a lot of folks that are passionate. And there's also the belief that this was because of Black midwives. Because in the South, about 90% of babies, white or Black, were caught by midwives in the 1900s. So because of the Flexner report, because of aggressive moves that came after to eradicate midwifery, thankfully not successful. But in Virginia, we had 9,000 midwives in the beginning of the 1900s. And then by 1960, we had about 600. So racism hurts everybody. So from 9,000, I mean, that is very painful, especially in the extremely diverse, racially, religious, et cetera, birthing community. That can really rally folks and help them understand.
Wow, that was a very clear and direct example around how you make it real. So, Dr. Robinson, what y'all doing in East Texas? I'm going to say it that way.
Living our best lives. No, I think, I'm so thankful for this opportunity to participate and collaborate, just because it's so easy to get in your box every day and come in and you have all these emails to work through, and then you look up and it's 5:00 and your emails are not responded to, and then you go home and what did I do today? When we think about what motivates us, what got us to this moment to do the work that we're doing on our small work versus our big work that motivates us. It takes moments and events like these to kind of recenter, to say, I'm exactly where I'm supposed to be. The things that motivated me to get here are the correct things. And how do I continue to do this work on a daily basis for a longer term goal? I am incredibly motivated and humbled by being a mother and thinking about this big work of creating a better place for my children, which, I laugh about. It sounds the equivalent to me of looking at medical school essays and the students are like, I want to help people. And yes, that's a noble and great and auspicious goal. And what specifically do you want to do to accomplish that? And I think that's the harder thing, right? I want everyone to have the want to help people somewhere in there. If you don't, that's another conversation. But what is your piece? What is your unique piece that you're contributing? I've always lived places where I've had so many resources, so many colleagues, and so many people who thought and shared core values. And I think it's the human condition. I fooled myself into thinking that this is how everybody thinks because everybody around me thinks this way. And whether it's at home or work or school or friends or the media that you select, you can be in a bubble where you're only around people who live, work, and think that way. And so I'm thankful and humbled for this opportunity to be in East Texas, where it's a very completely different environment. And to think, how do I partner in very creative and different ways with people who vehemently oppose DEI and saying, okay, now I'm in a space where I have to name it. This is diversity, equity, and inclusion. And the people that it benefits so much are people that so many people care about, which is children. And I'm a pediatrician, so that works well, but there is not a child who does not benefit from equity because every child is different and has different needs. You think about how children learn and about, even if your children is, gifted and talented and great, they may have asthma or they may have diabetes. And so how do we make sure that we've got equitable play spaces, equitable learning spaces, so that it has the accommodations that children need to be successful in the earliest years of their lives so they then can grow up to be adults? And if we all as adults just pause in a moment and think back about our childhood, there's a moment where DEI could have and would have made a big difference. I mean, we didn't call it that, and, probably won't be calling it that. But thinking about equity and thinking about equity in a very interdisciplinary and broad and audacious way, and then distilling it down to just a tangible moment for a mom or a dad or a COO or a CEO or someone who's never had to, or in their mind, never had to deal with difference.
Yeah.
You could say, oh, well, if you think about, white men are also not a monolith, right? And so everyone has some way where they show up in some space and they're different. And helping people understand that space of it is that first step in opening the door to some of these conversations.
Great. Thank you. Dr. Mallya, I want to come to you because there are a lot of things happening from the executive orders to policy statements coming out of different agencies. Can you talk to us about some of the biggest threats to equity efforts? And so one of the questions that we got is that if I'm doing research that focuses on a single race, will I be affected by the current policies? Or if my large corporation continues to support DEIA initiatives, will they be investigated by the federal government? And would everything now be considered DEI just because you have an intervention that focuses on a specific population, like in a rural community or Native American communities or people that may speak a language other than English? Can you give us some sense of what the landscape might be, and just so people can just have an understanding of where things are?
Easy questions, Anton. So let's see here. I think a really important thing for folks to remember is there is this wave of executive orders that we've been seeing over the past month plus. And the orders are defining diversity, equity, inclusion, DEI, in very broad and vague ways. And that's very intentional because they want everything that you mentioned and more potentially fall within this area of risk.
Yeah.
And it's not even that those executive orders are necessarily legal, but they want to create an environment in which if you even think you're doing work related to diversity, equity, inclusion, if there's 5% of you that feels like my work could fit into that definition, they want to get you to slow down or to stop or to even reverse course. That is the intent. It's not necessarily policy enforcement. It is getting inside people's heads for them to question whether their work is legal, valuable, and worth continuing. That is what is being attempted to do. So what do we all do in response? The first is to not engage in anticipatory obedience. That's probably going to be the word of the year. That's what I've heard. And that means that when a vague, poorly defined, misinformed, and potentially illegal policy is being put out, don't comply without asking some questions. Now, I don't want to be naive about people potentially losing jobs, funding, their social standing. All that stuff is incredibly important. But don't comply and do the work of the opposition for them. And I think what we're seeing among our partners, especially our civil rights legal partners, is there have been 3 cases already brought to challenge these anti-DEI executive orders. And you know what they're being brought on, the grounds that they're being brought on? First Amendment. This is a matter of free speech and free thought.
Yes.
Fifth Amendment. This is about due process. These policies are vague by definition to confuse us. We can't even comply if we wanted to because of how you've written them. 14th Amendment, equal protection. There is still a constitutional claim and mandate for everybody in this country to have equal protection under the law. So that's what I would say in response to these questions. And please, please, please get connected to our partners at the Lawyers Committee for Civil Rights Under Law and their pro bono DEI Defense Initiative. If you have questions about your racial equity program, if you think you might be sued, if you think your funding might get cut, reach out to them. They are experts in interpreting the law and helping you do your work moving forward.
That's fantastic. And you just gave me a mic drop moment there. Anticipatory obedience. I wrote that down because that's exactly the important point. I happen to be a former federal employee, and I was in a group chat with some former federal employees who basically said, until I see specificity around what this means for me, I'm not stopping doing my job whatsoever. And these are people who are not even in like healthcare spaces. These are the people who work at the FAA that I know what my job is. And we have a diversity business enterprise federal law thing that we have to do. We're going to keep doing what we're doing until we have some specificity that says you should not do what you're supposed to be doing. So it's good to have that confirmation. I want to shift the conversation a little bit because the big important piece for me in doing this podcast is to understand the people who are doing this work. You all are individuals. You all have lives and you have stories. You have reasons by which you continue to do this work or even came into this work in the first place. And I think it's important to not ever disconnect from who we are, because when the times get the toughest, it is how we stay the most grounded is to remember our why, our personal reason for coming into doing this work in the first place. So really, I'd like to hear from you. And I'm going to start with you, Dr. Robinson. As a physician, there's so many things you could be doing. Like I know that first year of med school, you were just trying to get through. And then when that fourth year of med school came around, it was like the world opens up. There's so many different things that you can do. But you chose to be in a role focused on patient safety, patient outcomes, and with that, a lens around equity. So give me some sense of what drove you to this work? What's the story behind Loren Robinson and why she is where she is today?
My mom is my first why. And so my mom is like me, but more fierce, just if you can imagine. And she just had this penchant for justice and for fairness. And from an early age, put that in me. And, one of the things I was thinking about earlier is as a young person, probably about third or fourth grade, maybe fifth grade, I read The Diary of Anne Frank. And for me, and I've always loved history and all of that, but I could not believe that this had happened. And then and now I was like, okay, you've got a group of what seemed like as a child, scary bad guys. But then I was like, but there can't be that many scary bad guys in the world. So what that told me was there's a whole bunch of other people who seemed like they didn't care. And that just blew me away. I could not imagine that there are so many more people in the world than just those people. And everybody was too busy or turned a blind eye or said it wasn't me or it's not about me, so I'm not doing anything. And that made me very angry. And I was like, I have to do something about this. And that's what motivated me. And then I went to med school and I was like, it felt, sometimes an unpopular opinion, but not in the public health space. It felt very paternalistic. I didn't go into medicine so I could tell patients what to do and have people listen to me. I didn't like that piece of it at all. I wanted to understand what my role was going to be in helping people. And as I went through med school and residency and the Affordable Care Act was passed, I was like, great, here's this thing. What is this thing? And all the people around me were just like, oh, it's just so poor people can get care. And I was like, okay, well, I agree with that general proposition, but there's so much vitriol and anger and TV airtime or radio time dedicated toward just doing that. So there has to be more than this. And so I went and did a Robert Wood Johnson Clinical Scholar Program so that I could better understand what is health policy, who makes health policy, and how does it go from an idea in someone's head to a bill or a law, and then from that, how does it translate into practice, and how does it impact the people where I live? And that's the piece. And as I gained different experience, I realized that where I thought it all was, because I thought it was D.C. I thought I had to go to D.C. and be in some place that had the largest American flag and put health policy into place to fix the thing. And then I was like, wow, this is so far away from any clinical practice that I would have or from the homeless person I walk by on my way to work. This is so far away from me being able to do anything to change this, which is why I think I got into kind of health policy at the local and state level and now in a healthcare system, thinking about how do we make sure that we have our little ecosystem here as a place where patients can be safe and can be respected and can be treated with dignity. I do that at, looking at data and looking at everybody washing their hands and all of that piece, but also in holding providers accountable. And I think that's the piece that is also important to health equity is we have multiple generations of physicians who are still in practice where health equity was not a priority. And you can tell by the way they interact with their colleagues and by the way that they treat and speak to patients that they are not yet in the fold. And so I use it as my unwritten job description to help bring them in the fold, to help them understand this is what this does. This is why it's consistent with our core values. And because I sit where I sit, if that does not work for you, I respect and understand this. And this is not a place for you to be.
Thank you. And that's so dynamic. So, Kathryn, you have a lot of reasons as to why you do this work. So share with us what brought you to the space you are in doing this work.
I have that one story. So I was an Army brat, and so I moved a lot. I had been to 9 different schools by the time I was in 7th grade. So really struggled to fit in, not just because I was that very loud, precocious child that couldn't sit down, but also then constantly moved and had to figure the space out again. And then I was a Peace Corps volunteer right after college. and it was in Mali in West Africa. I was sent out on my site visit. Peace Corps was supposed to arrange for there to be someone to greet me. And here I am, this white Christian, French-speaking 21-year-old in this town where everyone is Black. I'm the only white person. Most people are Muslim, and most people speak. I was learning Bambara, but most people actually spoke Hassanke, which is not Bambara. So I couldn't even speak like the local dialect. And the sun is setting, and I'm sitting there on the platform, and nobody has come to see me. I'm just sitting there, and I look like I'm about to cry. That was my go-to. And Sambu Dansko comes up to me and says, "Who are you? Can I help you?" Yeah. And I probably said, like, "Is there a hotel here?" He's like, "No, there are no hotels here. We're in the middle of nowhere." And I mentioned the name of the person who's supposed to meet me. And Sambu said, "Oh, they're not going to meet you. Your folks, they should know that, he's not going to be here." Then he said, "You know what? I'll take you home." And he kicked one of his kids out of their bedroom and gave me a place to stay. And to this day, my dad considers him my second dad. We WhatsApp all the time. And I think it was that moment when I came back to Chicago after the Peace Corps, and I actually have a very close friend whose son was shot and killed, like the stray fire. It was not a part of the situation. Yeah. And that moment we're like juxtaposing, my friend's son, who is a Black male on a train platform is killed because of his race. And I, as a white person on this train platform, embrace, adopt it, take it home and have it. It just, this, like, whoa, something is wrong with our system. And I have to figure out how this happens, and I need to fix this. And then, as Loren said, and then you have 4 kids, and then the fire becomes even greater because I'm 51 now. And I need to fix this now because I have 4 kids. And I don't want them to ever have a friend who is lost on a train platform.
Well, I thank you for being committed, and thank you for the story, and your experience has been incredibly important to hear, and grateful to have you a part of this conversation. So, Dr. Mallya, I'm going to let you close this out. I want to know your why. Why do you choose to do this work? So give us the backstory. What drew you to this work?
I love hearing everybody's stories. I love it. I love it. I love it. So I am the son of immigrants from South India. And my dad, who came to the U.S. in 1965, he believed in the ideals that America was founded on, not necessarily the reality, but he believed in the ideals. And that's what drew him here. And that's what drew him to leave his family. He's the oldest of 11 kids, to start a new life for the family that he was eventually going to have. And that idea of believing in the ideals of America, recognizing that we have not yet met them and that we all have a part to play in helping to meet them, that's something my parents really instilled in me without saying those words. Where did he go in 1965? He was a grad student at the University of Mississippi, 1965.
Wow.
So just a couple years after it was integrated. And I've heard so many stories over time. They've sort of leaked. He's shared them with me as he's gotten older and older. He eventually moved to Philadelphia and finished his PhD in Philly at Drexel. And I never quite knew why. And I found out about 10 years ago that his thesis advisor at Ole Miss was the first to allow international students and Black students to be in his lab. And he was eventually forced out.
Wow.
And this was 3 months before my dad was going to graduate with his PhD. And his thesis advisor said, "Stay here and finish. I need to go, but stay here and finish." Kathryn, you said second dad. This man was like a second dad to my father. And my dad said, "If you're leaving, I'm leaving." So he left Oxford, Mississippi, went to Philadelphia. He had to repeat a whole year and a half of his education, but he felt like that was the right thing to do. And that's how we ended up in Philadelphia. And I have lived and served in health and public health in Philadelphia since that time. So that's a little bit about my story and my why.
Wow. 3 incredibly powerful stories from 3 incredibly powerful leaders. that remind all of us and ground all of us. We all can take something away during these tough times to remember the purpose behind the person and be the person who lives by their purpose. So Dr. Mallya, Dr. Robinson, Kathryn, I want to thank you all for being with us on this episode of The Intersection. I really appreciate your insights and experiences as we all work together to navigate this changing landscape. I also want to thank the audience for listening to the Intersection podcast. For more updates on future events and to join our mailing list, find us online at meetattheintersection.org.